Well, I had both hips done at the same time, and with the small incision and about 3-inch incisions for each hip. And I live in a 2-story home, and I went home on crutches and went up the stairs the first day and was able to get around and progress from there. Well, I felt pretty good after about 3 weeks. I felt really good after about 6 weeks, and every day from that point on was a great improvement, and I stayed out of work for about 12 weeks. I'd have to say the one thing that surprised me the most was the lack of pain that I had after the surgery.
At night, I did experience continual pain at some point in every night's sleep, so it was affecting how I slept. That's what forced me to finally go ahead and get the replacement surgery, and now 2.5 months after the surgery, I'm back to normal activity level and not quite brave enough to get on the snow ski slopes yet, but maybe in a couple of months. This mini incision that I got enabled me to recover in half the time that normal hip transplant or hip replacement patients recover in, and so for that I'm very satisfied and very happy. The whole stipulation of me returning to work was climbing the stairs to get into the airplane, and the awkward positioning of my leg to get into the pilot's seat. Those turned out to be a non-issue after about 2 months' time, and I gave it an extra 2 weeks just to make sure and to appease Dr. Dorr and the FAA to allow me to return to work.
All right, my name's Mark Felton. I am a double hip replacement. I had my first one done about 6 years ago. I gave it to myself for my 40th birthday present. Dr. Dorr did it at USC University. And I was 5 days in the hospital with not getting out of bed for the first 3 days. This time, I had my right hip done, and it was Wednesday. Today's Friday, and I'm leaving. I was up within 24 hours. The incision is 3 inches compared to 13 or so inches on the other side. One of the reasons why I had the right hip done was because I was so encouraged by the success I had with the left, even though the process immediately after surgery was difficult. This time, the process after surgery, the difficulty has been completely removed. I have had very little discomfort. So if I ever needed my third hip done, if I ever had a third hip, I wouldn't hesitate to do it at all. It's been fantastic.
See, in 1987, Dr. Dorr replaced my left hip total, and I was in the hospital for 10 days for that with extensive therapy. And at the end of 10 days, I had trouble walking at that, but they let me go home. Subsequent to that, I've had the right hip replaced yesterday morning. And here it is this morning, and I can walk without help if I want to. And I'm on my way out of here. Great hip.